The eyes are on the Jersey Shore. Hello, everybody. I am Vin Avenue at the Town Square Media Jersey Shore newsroom in downtown Toms River. And with me today is Ocean County Public Health Coordinator Dan Regenye as we close out 2021 amid a rise of latent COVID cases. So we'll be discussing that and then getting into a little bit some of the Christmas holiday tips and advice, things to look forward to, try to have a little bit of fun to close out our conversation. So Dan, certainly a lot going on. I appreciate you taking out some time.
Yes, thank you for having me once again.
So I think a lot of the focus of late has been on this Omicron variant. Perhaps in some ways, people forgetting that the Delta variant is still out there and very much active. With what you've seen in the last 3-4 weeks with cases going up, especially in Ocean County, is there something that's presenting itself that says it's all Delta or mostly Delta or a lot of COVID cases, and any contact tracing that can go back to Thanksgiving gatherings or holiday shopping and anything?
Yeah, so I think there's obviously we are seeing a large increase, and that's of a concern to us. I mean, it's not surprising. It does match an increase that we had this time last year as well. I think it's linked to all those different activities that you mentioned. That's statewide, that's nationwide. I don't think that's unique to Ocean. We are experiencing a high volume of new positives with this, though. So that's something we continue to work diligently on and getting some of the messaging out, the best ways to help prevent some of this further spread. And we just continue to urge residents to be cautious with that, and especially those that are the highest risk. I mean, that messaging has not changed from the beginning. If those that are high risk, please do everything you can to take all the necessary precautions and to avail yourself to any of the vaccination opportunities. We have a lot of them that are out there. We've continued, it's almost a year now that we're closing in on the vaccinations. We've surpassed over 121,000 shots that we've administered alone from Ocean County Health. So we have a lot of partners out there to help service the residents of Ocean County, and we encourage the residents to access one of those points.
I know we've talked recently, maybe about a month ago or so, about the differences between the vaccination and the booster shot itself as it started to become more available. Is there as much concern with people getting COVID, even including one of the variants as well, for among those who are already vaccinated? And would it be better to get the booster shot, or is there, do you think, enough science out there to show that getting the booster shot would help fight off whether it's the Delta variant or the new Omicron variant?
Yeah, and we're definitely recommending the booster shot with this. What we're seeing in a lot of the communication and the data that we've seen is that there is a waning immunity over the course of time. And that's why the booster is so important. And that's typical with a lot of other vaccinations as well, that over the course of time, that vaccination can only carry you for so long. It's definite that the vaccine is effective and protective of the serious illness. The vast majority of our hospitalizations right now are in an unvaccinated population. We are seeing breakthrough cases, but if you had to rate them on a scale from 1 to 10 in terms of severity of illness, these COVID cases of the vaccinated population are at the much lower end of that spectrum with this. So they're experiencing much less severe illness and disease with this. So we are encouraging, if they have not started their series of the vaccine, to get that and start that. If they received the vaccine a while back, then we're encouraging them to get their booster shot. And based on where they're at and what vaccine they received and their age, they can contact us and we can help them walk them through those guidelines.
Overall, just going back to the COVID front, with people who are either vaccinated or not yet vaccinated, with who is getting affected right now, are you seeing any kind of certain trend in Ocean County among the people who are getting COVID with whatever symptoms they're showing, or no symptoms that they're showing or having?
Yes, I mean, it is all ages are getting it. What we're typically seeing is more like in the 20 to 30, low 40 age range that are getting it. And those are the more active folks that are out there. Obviously, the kids in the schools and whatnot, we're seeing a lot of activity with that. For the most part, with the kids, though, they're faring a little bit better with the disease onset and the illness component to it. So That's good news, but at the same time, they can still spread that virus to those that may not be as fortunate with that. So that's why we're encouraging everybody to get vaccinated and to continue that progress. That's probably the best tool that we have at this point to help get ahead of this.
What is the testing situation in Ocean County right now with where people could go to get tested, with anything that your department is running or anything else that you know of where people can go and get a test? Number one. And then number two, how effective do you believe the rapid test is in detecting COVID? You know, you hear all sorts of things, whether it's locally, even with professional athletes who have to pass get a negative COVID test, and then hearing positive, oh no, and then the next one's negative, then the next one's positive. So just kind of twofold there with how effective the rapid tests are and then where people can go to get tested.
And the rapids are effective with everything, but we would also recommend to get a confirmatory with a PCR test. So if somebody goes in for a rapid, and there's many access points that a person can go to, the benefit of a rapid is you get it very quickly. There are rapid PCRs now as well, and that's something that I think with technology has kind of come a long way with it. The PCR still remains the gold standard. Sometimes those results could take maybe 24, 48 or more hours to come back though. So that makes it a little bit more difficult, but the rapid is effective as a basic screening tool, but it does not replace that gold standard of the PCR test. With the testing that we've been doing in Ocean County, and we maintain our testing site at Ocean County College. We've had that in operation since March of 2020. So we're closing in on 2 full years now at this point. We're only a couple months away from that. We've administered over 31,000 tests at that location. It's a drive-through location. We operated ourselves for many of those months, and the vast majority. Just recently, in the last couple of months, we actually contracted it out. So Immediate Care is performing that function on our behalf at this point, so we can then focus on the vaccination piece and put all of our resources to help on the vaccination front as well, to beef up some of those vaccination opportunities throughout the county. But that does remain in effect to today. They're operating there on Wednesdays and Fridays, and that's from 10 to 3 that a person can go there and get tested. We've adjusted that based on the demand, and that's something that we work on every week with them to look at what the demand is. There's still about, I guess, between 70 and 80 tests per day that they perform there. But that's not the only test that's available in Ocean County. A lot of the Immediate Cares are performing these tests. There are some pop-up testing sites throughout the county. Some of the pharmacies are performing this test. If somebody visits their doctor, they could perform the test right there as well. But there are many, many opportunities for testing throughout the county, including our federally qualified health centers of OHI and ComEd. They have multiple sites throughout the county as well. So there are many opportunities for residents to get tested, and we are encouraging them to get tested if anybody does become symptomatic, even if they're vaccinated, just to know for sure, because we are seeing those breakthrough cases.
Just one more question on the testing front before we move on. Have you seen much of a difference in, I guess, the results of whether it's a nasal swab sort of test or a saliva-based test with how it comes back, or what's more popular among healthcare workers and healthcare facilities? Is there much of a difference between which one is more effective in showing what you do or don't have?
Well, I think it goes back to the type of test that it is. If it's a PCR nasopharyngeal or a PCR saliva test, they're both PCR, so they would both be very effective in conveying the results for that. Obviously, the nasopharyngeal is a little bit less comfortable, I would say, but I've had it done many, many times over the course of the last 2 years. I mean, it's uncomfortable, but it lasts a couple of seconds, and that's it. Within you have some good reliable information and data to go on at that point. With the saliva, there's you would be given a tube, and you just have to fill it with the saliva up to a certain level. I mean, it's a little bit easier from that perspective, but you do have to fill that tube up. So I think it's a matter of preference. Both are equally reliable with it, and it's a matter of preference with that. There are more the nasal tests available than the saliva tests at this point.
Going with the holidays underway, the holiday season, Christmas coming up and everything, and with where things have been trending, with how many people have been getting COVID in Ocean County specifically, how concerned are you with the Christmas and New Year's approaching, with different gatherings or traveling parties, however small or large they may be, over the next 3-4 weeks as we head through Christmas and into the new year, with any more cases surfacing based on how many cases have been popping up in Ocean County of late?
Yeah, anytime you're kind of gathering indoors, and this is the time, unfortunately, from a winter perspective, that it's a little bit more difficult to celebrate different activities outdoors with it. Anytime anybody comes in close quarters and close contact indoors, that is concerning, because that allows more opportunity in close proximity to share the virus, quite honestly. There's a lot of things we want to share this time of year, but we would try to prevent the sharing of the COVID-19. So there's a lot of prevention components, some pharmaceutical, some non-pharmaceutical, from the vaccine to wearing a mask, to all your basic hygiene of washing your hands, covering your cough. If you're ill, staying away from other people, especially if they're high risk. So all those things, that messaging has not changed, and that's been a messaging of all respiratory illnesses well before COVID as well. I mean, that's our standard messaging this time of year for the last several decades, quite honestly, of flu season. We're kind of on the doorstep of that and entering a heavy flu activity season. We are seeing some of that activity now as well. So in addition to the COVID vaccine, we're also recommending to the residents to get their seasonal flu shot as well. That's equally as important. The last thing somebody would want is to be co-infected with a seasonal flu and a COVID. Each of them individually could cause a great deal of harm. Collectively, the two of them combined could be devastating with that. So there are simple things that are very effective, not 100% foolproof, but could definitely put them on a better road otherwise.
You hit on a couple points too I want to get to now, is to make it a transition with the holidays and everything going on with the flu, with COVID, and whether it's people gathering, going to work, going shopping, getting their Christmas shopping done, even though, shopping online is all the popular choice nowadays anyway. But what are some pieces of advice, some tips, things that people should be doing at home, going to work, going to the store, wherever, with whatever they're doing, Christmas shopping, going to Christmas parties, doing all sorts of fun stuff over the next few weeks as well, whether it's to avoid COVID, the flu, or something else? What should people be doing as they're kind of going to and from?
Yeah, I would say just keep their guard up. I mean, we're still kind of in the thick of this, and you can see that with the numbers that are kind of being reported each day. So we're certainly not out of the woods, and we still have a ways to go with this. We were hoping that we would have been at a much better place when we were at this point last year, with the vaccine beginning to start up. And I think we did make a lot of progress with that, and we saw a lot of benefit and some movement in a good way. But I think it's just looking at trying to keep some of that progress, get people back on track to look at the benefit of the boosters and get that population boosted as best we can. I think statewide there's about 34%, if my statistics are correct, the last I heard, of statewide, of those eligible to receive the booster have received it. And Ocean County is right on par with that, with the work that we've been doing. We're about 34% of the Ocean County residents eligible to get the booster have received the booster. So that's great news for that 34%, but we need to move that into the other percentages that have not received it yet, and try to get them to get that booster as soon as possible. And even more importantly, if they haven't been vaccinated at all, the importance of getting that at this point is very significant.
Dan, I want to touch one more thing with the holidays as well coming up that I just thought of. The winter break with schools, whether it's the week leading into Christmas or the week from Christmas into New Year's, however the school system puts it together, with teachers, students, everybody kind of being out of the building for about a week or so. What are some things that schools should be doing before they go away for break, before everybody comes back? And then what should people the students, the teachers, the faculty, what should they be doing while they're on break to not even accidentally bring any kind of illness back, whether it's COVID, the flu, a common cold, or something along those lines.
Right. Yeah, I think the message there would be probably the very similar, keeping their guard up, trying to avoid situations that would provide exposure to them or to expose anybody else for that as well. If they're moving in out of state or out of county to visit relatives or family or whatnot, just do that in a diligent, responsible way, to take care of themselves, their family and their loved ones, and then coming back and hopefully don't bring anything back into that school environment. I know the schools have been doing a great job. They're working tremendously hard. We have a team of staff that work with them almost on a daily basis. We have a liaison to every school in Ocean County that works with them and helps them, guides them through some of the protocols that the state has set forward. And we've continued to do that, and I know that they're all working extremely hard, and they're doing a great job with this. And they're in a tough situation with this. And at the same time, all the efforts that they've done on the cleaning side of it, they've stepped up all the cleaning of the classrooms and things of that nature, which is important as well. So just continuing with all of that as we move through this, and keep their guard up, and everybody to do their due diligence. And I've kind of said from the beginning, it takes a community to try to get out of this, and everybody has a role, responsibility, individually, as a family, and as a member of community, to be able to do their part to help us get out of this.
To close out here, lots of goodies around the holidays, and cookies, cakes, eating all kinds of stuff, and drinking all kinds of stuff, I guess, as well. But what would your piece of advice be to anybody out there trying to close out the year in a good way, have some fun, and not necessarily feel too sluggish or bad about whatever they ate or drank the day before?
Right. Well, a couple of things, I guess, is one is it's never too late to increase your own personal health status. And I think we've had that same conversation a while back as well, through our conversations with yourself and others as well. And make that New Year's resolution to try to get a healthier state of body and mind with everything. It's been a challenging 2 years for everybody. One thing for sure is that those that are in a better state of health have fared better with COVID. And if they were infected with the COVID, there are simple steps that people can take. It's a great time of year to set that New Year's resolution, to shed a few pounds, to begin to eat healthier, to get some exercise. Those are very simple, easy steps that people can do as they move forward. And if they were to be infected with COVID, they're going to fare better with that illness. And that's going to be across the board, not just with COVID, but their better overall state of health will help them just be a healthier person with that. And I think that's a huge step that somebody could do. It's that time of year to set those New Year's resolutions, but also looking back retrospectively, it has been a challenging year of 21, even 2020 as well. So the last 2 years have been extremely challenging, but at the same time, there's been a lot of, I think, success and things that we should all be proud of. And I think they should reflect on that, and just not look at the things that were so challenging and so difficult for us as individuals and families and members of our community, but try to celebrate some of those things. I know there's been a lot, and everybody's different related to that. And to celebrate that, make some plans going into 2022. And hopefully 22 will be a much better year as we kind of move out of COVID. That's what our hope and vision is. And we are certainly doing everything that we can at Ocean County Health to prepare that and to get that to that state of mind and everything. And I thank everybody for their patience over the course of the last 2 years. And remember, we're living this too. I mean, we're people, we're residents of Ocean County ourselves. We're not just Ocean County Health Department, but we're moms, dads, sons, daughters, everything. You know, we have family that are affected by this as well, just like everybody else. So, but the staff have been doing a great job at the health department. We have a lot of great partners throughout the county, and we're very appreciative of that at this time of year.
Dan, I appreciate you taking out some time to discuss all the latest with COVID in Ocean County, and with the tests, results, vaccines, booster shots, everything that everybody needs to know. Because, you know, you certainly see numbers that are a little higher, and it gives you some pause. But hopefully, people continue to do the right thing, be safe, get vaccinated, and that a New Year's resolution for everybody will be to have a much healthier and safer 22 than 21 or 20.
Right. Nothing better than let's close the lid on this COVID once and for all. Let's move forward.
That's a good goal too for the new year.
Yes.
And Merry Christmas, Happy Holidays, Happy New Year to you and your family and everybody at the Ocean County Health Department.
And you as well. Thank you for your efforts and helping us get the message out.
That is Ocean County Public Health Coordinator Dan Regenye. I am Vin Ebenu, and thank you for watching another episode of Eyes on the Jersey Shore.